First of all, I would like to actually not just congratulate you, I would salute you and offer my utmost gratitude. You are the provider of health and care board. When I say care, I don't just mean the material care, I mean
of today's session, Dr. Deepak Puri. Sir is the Director, Cardiothoracic and Vascular Surgery to our university. Sir.
Thank you.
First of all, I would like to ask you a question. Do you think men are more affected by cardiovascular disease or women? So all those who say men, kindly raise your hands. So I think 90% of the people, they think that men are more affected by cardiovascular disease than women. Today I am going to tell you the facts, and I am sure once you walk out of the hall, you will change your opinion. Published this article in Femina. So Femina, all of you know, it is a very popular women's this, what I stated was that cardiovascular disease among women is underdiagnosed entity and also an undertreated entity. So now I'll tell you a few facts. Here you can see cardiovascular disease and heart disease deaths, they are on the rise. So India is the coronary capital of the world now, and the incidence of heart attacks is highest among Indians, and it is affecting both men as well as women. You can see that the incidence is rising steeply since the last 2 decades, and also it is rising in women also. But here in the graph you can see that it is rising more in men and less in women. So actually it is not so. It is because in women it is underdiagnosed and undertreated. So here you can see that heart disease actually is the #1 killer among women, and more women die because of cardiovascular disease than men across the globe every year. And in US, 50,000 more women die compared to men because of cardiovascular disease. And you will be surprised to hear that 64% of the women who die because of heart attack, they don't have any symptoms. So they die suddenly without knowing, without getting diagnosed of heart attacks. And 90% of the women, they have got more risk factors compared to men of having cardiovascular diseases. And also the risk of stroke is also much higher in women compared to men. Main cause of not getting diagnosed is that the cardiovascular disease is totally different. The symptoms are different in women. And also important fact is that women, they also have more diabetes, and also obesity is more in women. And if a woman has diabetes, her risk of getting cardiovascular disease increases by 3 to 7%, whereas in men it only increases by 2 to 3%. So most of the research that has been done in cardiovascular disease, that has focused mainly on men. So that is why people don't know the actual facts. I'm sure when I walked into this hall, everybody was thinking that already we know so much, everything we know almost. What is the point of giving this talk? So now I'll tell you what actually we know, what are the myths, and what is the reality. There are 2 events in women's life which are totally different from men, and that can test the endurance of the cardiovascular system. So I'm sure you know about these 2 events. One is pregnancy and one is menopause. So these 2 events, they test the cardiovascular system. So what are the things that happen in the pregnancy that can affect the cardiac health? These are like some women, they have hypertension during pregnancy, or their sugar levels rise during pregnancy. Some have preeclampsia. Some women, they may have a premature birth. Some women, they can have polycystic disease of the ovaries. So all these things, they increase the cardiovascular risk. And after delivery, most of the women, they don't come back to their normal body weight and shape. Many of the women, they may come back to the normal weight and shape. Shape, I mean the waist circumference. Waist circumference is very important, and in my subsequent slides I'll tell you what is the importance of waist circumference. So those women who come back to shape, they also have a higher risk subsequently in the later years of their life, and those who don't come back, the risk is even higher. During menopause, certain changes in the body occur. There is a drop in the estrogen levels, weight gain occurs. Some women, they may start smoking or they may get addicted. Many women, they get stressed. Some have a family history of early menopause, that is an additional risk. And also some women require hormonal replacement therapy. So all these things, they carry different risks. During menopause and after menopause, like there is a perimenopausal phase in which lot of changes occur in women's day-to-day life, and they get hot flushes, they get night sweats, irregular periods, mood swings, loss of libido, weight gain, osteoporosis, and then they exposed to the risk of heart disease. Some women go into depression, some can have incontinence, and the sexual dysfunction can also occur. So all these things contribute in a large way to progression of cardiovascular disease. And it is a known fact that the coronary artery disease progresses slowly before menopause because of the benefits of estrogen. But after menopause, it rapidly progresses. So there is a sudden progression after menopause. And also those women who have early menopause, that is premature menopause is before 40 years and early is between 40 to 45 years. So those who have early menopause or a premature menopause, their risk of getting cardiovascular disease increases by 40%. What happens actually is that estrogen is one hormone which is secreted in the woman bloodstream during the reproductive age, and this hormone, it has a good effect on the vessels. It dilates the vessels, it slows down the progression of atherosclerosis, and also it protects the heart. So once the estrogen levels start falling, then the protective effect goes away. Another important fact is that women, they are more prone to get stressed, and the incidence of depression is more among women compared to men. This also contributes in a large way in the progression of cardiovascular disease. As you know that the coronaries which supply blood to the heart, they are known as the coronary arteries. So whatever cholesterol, whatever fat we eat, it gets deposited into the wall of the coronaries. And it starts early in the age. Most of the people think that it starts in middle age, but actually it starts in the first decade itself. And how fast it will grow depends on number of factors. One is hereditary, other is our lifestyle. So the hereditary is non-modifiable. And also there are other factors like some races like Indians, they are more prone to get early heart disease, coronary disease. And then as we grow older, the risk keeps on increasing. And at the same time, the lifestyle also plays an important role. Plus, whether the female is a premenopausal or postmenopausal, so everything has a different role. So once the effect of estrogen goes down, the disease progresses very rapidly. So most of the women and most of the societies in the world, they are projecting that the most important disease that affects women is any cancer? Breast cancer. So all the campaigns, they are focused on breast cancer. So here you can see that 6 times more deaths occur in women because of heart disease compared to breast cancer. And the number of women who die because of heart disease, the number is actually much more than the total number of deaths because of all cancers combined in women. So you can imagine what is the magnitude. normally a heart attack occurs because of blockages in the artery, but in women, some different physiology occurs. Like in normal person, the plaque gets cracked and there's a thrombus formation. But in women, it's totally different. There is a slow dissolution of the plaque which causes blockage, or sometimes there can be just spasm of the artery, like artery it constricts, or there may be some microvascular angina, like the smaller capillaries, they get blocked. So if you do a normal angiogram, there's no blockage, but actually it is at the microvascular level. So in women the physiology is totally different from men. And also it is seen that once a woman gets diagnosed, what do you think? The probability that the woman will get the intervention done is more or compared to men, or less? Less. So most of the women, they try to defer the procedure on some pretext. So it is seen that almost 27% less percutaneous intervention like stenting are done in women. They try to defer it. And if you see about the bypass procedures, 38% less women compared to men go on for the bypass procedure when they already know that it is required, but they keep on postponing it. Another very interesting problem that occurs in women is, have you heard about Heartbreak Syndrome? So it is very common in young women. So the Japanese, they labeled it as Takotsubo cardiomyopathy. So it is because in Japan, to catch the octopus, you know, it is a sea animal. So to catch the octopus, they have a trap. So the heart becomes like the shape of the octopus trap. So that is called Takotsubo in Japanese. So this is known as Takotsubo cardiomyopathy. So what happens is that after a sudden, like you have some very stressful situation, the woman has a heartbreak, and then there may be chest pain, palpitation, shortness of breath, and women come to us. So initially, when we are not aware about Takotsubo cardiomyopathy, we used to wonder why so many females, young females, they come to us with symptoms. But when we investigate, all the reports come normal almost. So then we realize that it is because of, then we take a proper history, and then we come to know that it was because of some stressful situation, because of which the function of the heart became like this. So fortunately, this is a treatable condition, and by little assurance and support, the woman recovers within few months, and some women may require some medication. But it has to be diagnosed properly, because most of the time the diagnosis is missed, and sometimes they refer the woman to a psychiatrist, or sometimes they keep on thinking that woman may be a malingerer. So most of the times it is missed. Now, after listening to all these facts, I will talk about 7 ways which the American Heart Association has recommended that by which we can reduce our risk in women especially. So everybody should know about your blood pressure. How many of you know about your blood pressure? Most of you know. Okay, good. So what about your cholesterol levels? Some people, they know about their cholesterol levels also. Do you know your pulse rate?
Yes.
So, like you remember your telephone number, you should remember all these figures also. Your sugar level. So anybody knows what is the ideal fasting blood sugar?
Less than 100.
Below 100. Okay. So I'm happy I'm addressing a very learned audience. So getting physically active. So do you know the recommendation for physical activity, like how much activity we should do in a day? Everybody talks about steps. So actually it is very fallacious, like you count the steps and you think that you have done enough. But today I'll tell you what is enough, and we have a fitness and physiotherapy expert here. So she may be knowing 1,000 times more than me, but whatever little I know, I will share with you, and then she will share more. So another thing is that your eating habits should be healthy. So everybody knows about what is healthy eating. I'm sure everybody knows. And we should lose weight. Weight should be under control, and we should quit smoking. So smoking is the #1 killer. So we should quit smoking. And in women, if we have to diagnose the heart disease, sometimes we have to do some unconventional tests, and we have to go into the depth. Only then we will be able to diagnose. My question is that at what age should we start cleaning ourselves? Somebody said 30. How many say 30? Any other? 25. Anybody for 25? Anybody below 25? 18. Who's for 18? Yes. Before. So actually, you are never too young to start screening yourself. So I would recommend that you should start right from your childhood. So I will, if we have time, I'll tell you about one of my group, Cardiovascular, which is started in 2011, and how we have been making people aware about what should be done to prevent heart disease. So first thing we should do is primordial prevention, which is starting in the very childhood itself. At that time, there are no risk factors, but we make the child aware about how to take care of the health. So it is the responsibility of the parents and teachers. So next comes the teenage. So in teenage, many people, they acquire risk factors. Somebody may start smoking, somebody might start abusing alcohol, somebody might be physically inactive, somebody might be having stress, and somebody might be having overweight, obesity. So in that stage, we have to do the primary prevention. So how we can do it? We have a performer. So you just have to fill the performer. It is based on your lifestyle and your hereditary risk. So once you know your risk, then once you identify your risk, only then you can start taking care of them. Because most of the people, they don't even know what risk factors they have. So how many of you who are here know about your own risk factor of getting cardiovascular disease or any lifestyle disease? Anybody knows? We just hope that everything will be fine and this is time to enjoy it. So why bother? So whenever we have some problem later on in life, then we will deal with it. But if you take care from now, you can reduce your risk of getting cardiovascular disease, and you can even prevent it throughout your life. But if you don't take care, suddenly we get people coming in the emergency with a heart attack. And I have operated even 24-year-old girl with a heart attack. I've done a bypass surgery. So I feel very sad that this could have been prevented. So if you listen to my talk carefully, we will gradually discuss what all we can do. So simple walking. Walking reduces the risk by 60%. So if you walk every day, you can reduce your risk by 60%. Smoking, if you quit, 18% reduction. Cholesterol, if it is under control, 10%. And high blood pressure under control, another 10% reduction. What kind of physical activity? Like most of the people, they are following this. Sitting on a couch, doing WhatsApp, Facebook, and every day chatting. Most of the time is spent. But now it is known that if you spend more than 8 hours in a sedentary lifestyle, your risk of dying within the next decade or so increases. So we have to get rid of it. The risk of getting diabetes, risk of getting heart attack also increases by sedentary lifestyle. So it is recommended that you should not sit for more than half an hour. So after half an hour you should get up, do some activity. So maybe you can tell better what activity you can do. But sitting more than half an hour, it is a risk factor for cardiovascular disease. I'll tell you about the recommendation. The American Heart Association has recommended that you should walk at least 30 minutes brisk walking, which you should cover 4 kilometers every day, 5 days a week at least, for a normal person. And if you want to reduce weight, then you should do 60 to 90 minutes. Also, they say that if you don't like to walk, then if you do some cycling, swimming, skipping or any other more strenuous activity, then you can do 25 minutes a day, at least 3 days a week. So 150 minutes is for or 25 minutes of strenuous activity, that is minimum required. And apart from that, like if you have to do some weightlifting or other kind of activities, so you need not do it every day, you can do it 2 times a week, because many people they do lot of weightlifting and all, and later on I'm sure Dr. Narula must be seeing those patients, like they come with a slip disc, with joint problems, knee problems. So excess of exercise, excess of gymming is very harmful, so be careful. We can make the physical activity interesting, like there are other forms like you do yoga, you do aerobics, you do Zumba, you do any form of dance. So actually it has been recommended that if you do all these things, it has a very beneficial effect, and most of the benefits they are written here. I don't want to read every benefit, but the thing is that those people who dance is seen that in old age they maintain their posture and their like balance more, like in their 80s, in their 90s, they don't get senile dementia and they can walk without a stick. So because it helps the brain in maintaining coordination. So dance is a very good exercise. So anybody can practice it. If you just dance to 3 songs every day, you will remain healthy even when you become 90 or 100 years. This is the comparison of the artery of a person who has a sedentary lifestyle. So there's so much of cholesterol deposited in the wall, and this is the artery of the person who exercises regularly. So you can see the difference. Now we come to the diet. So in diet, you know what we should take maximum? Maximum should be fruits and vegetables. 5 to 6 servings is the recommendation. I'm sure none of you takes 5 to 6 servings of fruits and vegetables. Also, we should take very little of oil, especially trans fat, saturated fat. Saturated fat is butter and ghee, and trans fat is when you go and eat those tale hue samosas and pakoras. So the oil is getting heated from morning to evening. So that carries a very high risk of getting heart disease. If you want to remain young forever, then you should take more of fruits and vegetables, and you should avoid junk food. So we come to the obesity. Like anybody can define obesity. Anybody knows what is obesity? Generally speaking, we say obesity is overweight, like when you carry excess weight. But scientifically we calculate by calculating the BMI. But is BMI the most accurate way of determining obesity? When we measure the BMI, first of all we should know that our parameters as Indians and Asians, it is different from Western countries. In Western countries more than 30 BMI is obesity. But in our country more than 25 is obesity. Overweight is 25 to 30 in Western countries, ours is 22 to 24.9. Underweight is less than 18. We cannot compare with the Western population because our risk of coronary disease is much more than them. So we have different parameters. Plus, nowadays, the waist circumference is considered the most accurate measure of obesity. So why? Because we have 2 kinds of obesity. One is pear shape. In pear shape, like in Western countries, the fat distribution is all over. Like you have fat in the thighs, you have fat on your shoulders, in your arms. But in Indian population, most of the Indians, they have normal body, but their fat is in the abdomen. So they have a apple shape, paunch is there. So this carries maximum risk for cardiovascular disease, diabetes, and even cancers. So anybody knows how much should be the waist circumference? In Bollywood, lot of songs are there on the waist. ना वेस्ट के ऊपर बहुत सारे सॉन्ग्स होते हैं, कमरिया कमरिया, लेकिन Have you ever thought कि क्यों waist के ऊपर इतना focus होता है? Because a narrow waist is considered sign of health and fitness. कितना होना चाहिए waist? Anybody can tell me कितना होना चाहिए? Somebody is 6 feet tall, उसका waist
So less than
different
half, if I'm not wrong.
less than half of.
The height of the person.
Very good. Everybody should clap for. So your waist should be less than half of your height. If it is more, then you will fall into obesity. Even if you are normal weight and normal BMI. So many people who want to go for weight loss. So what mistake most of the gym and most of the dietitian, what they do is they reduce your muscle mass, fat as well as water. Some people they prescribe diuretics to lose weight. Some people they prescribe, one of Bollywood heroine, she called me up that I've been prescribed this medicine to lose weight because I have to wear a bikini in the next movie. So is it okay? But that was a sympathomimetic drug by which you can increase the heart rate, burn more like calories and more adrenaline rush. So it can expose you to so many cardiac problems, including heart attacks. So man, you must have heard that some person was very fit and suddenly he died. He used to gym every day and suddenly he died or she died. So all these things can happen if you are abusing rather the drugs. Next we come to two things, smoking and alcohol. So about smoking, I want to be very clear that smoking is bad. Even if you smoke 1 cigarette a day, it is bad. And for women, those women who smoke, their average lifespan is 11 years less than those who don't smoke. And smoking can cause so many problems. It can affect almost any organ of your body, your lungs, your heart, your kidneys, your brain. The risk of stroke also increases, risk of heart attack increases, lungs getting damaged increases, the risk of dying if you have COVID increase if you are a smoker. Risk of having lung cancer also increase. So smoking is not good. But unfortunately, in the last few years, we have seen that India ranks second among smokers, and the incidence of smoking is decreasing in males, but it is increasing in females in the last decade. So which is not good. What do you think? Alcohol is good for the heart? Actually, WHO recommends that if you don't drink, then there is no indication to start drinking. There is no medical indication. But for those who drink, they should drink in moderation. For moderation means for females only 1 drink in a day is permitted, and in men 2. Why? Why they are unfair to women? because the metabolism is different. Like women attain more blood levels and which are harmful, and the chances of getting breast cancer and heart attack and heart failure, they increase in women. And these risks are more compared to men. Like if a man takes a particular amount of drink, he will be less harmed, but a female takes the same amount of drink, she will be more harmed. Fortunately, drinking has been a cause of death in more and more working women nowadays. So I don't know whether you know this fact or not. So what is the best drink? Water is the best drink. So if you take 5-6 glasses of water every day, your risk of getting a heart attack reduces. And actually, we basis that wine is good for heart. It is based on the fact that in Europe, people they take wine in small quantity. They take it with the supper, evening supper, and they take it slowly. So the absorption is very less. But the drinking pattern among Indians is different. Indians they take once in a month and once in a 6 months, but they take very fast and they take too many drinks. So that is very harmful. That is known as binge drinking, and that is very harmful. So if somebody takes just one small drink slowly, sip by sip, and finishes in several hours, then the harm will be much less. But if you take very fast and without taking meals at the same time, then the absorption is very fast. So it is very harmful. Other addictions apart from smoking, drinking. So how they work is that, like your mobile, it gets discharged by evening. So once it starts getting discharged, you will be rushing in search of the charger. So similarly, our brain, it gets so much dependent on the addiction stuff that we run around seeking कि smoke है आपके पास, वो alcohol है, drug है. We become desperate because we need to recharge our brain. So that is dangerous because then person can end up with so many health problems. So next we come to the stress. Stress is very important. It is a major cause of heart disease nowadays. So what is stress? Is stress good? Anybody who thinks that stress is good? So stress is good. You know what is called a good stress or used stress? So like if you are walking on a road and a dog starts running after you. So what happened? It is a stress. So the body gets charged, adrenaline rush is there, your heart beats faster, your blood sugar is mobilized, your muscles they contract faster, and you can run so fast that you can even beat a marathon runner. But up to a certain extent. Then you reach a stage when you start burning out. So that is the breakdown phase. So if we make the dog run after us every day. So if we get up in the morning and think कि आज ये हो जाएगा, आज ऐसा हो जाएगा, मुझे ये हो जाएगा, मुझे, then we are imagining that the dog is running after us, and we may land up with a breakdown. So how this happens is that it may be acute phase. So all these things they can happen to you when you have acute stress, and it may be a chronic. If you keep on having same thing for long time, so many things may happen, and ultimately person can become irritable. You may go into depression, and so many health issues they start arising. So in women, like what are the main causes of burnout? So it may be work overload, too much work to be done, lack of control, and then insufficient reward. Like if they are working hard but nobody is appreciating, and then unfairness. Like if there is a gender bias in your workplace or in your studies, and then breakdown of community support. If the community is not supporting you, and sometimes there may be a value conflict. Like your parents want you to do something, but you want to do something different. So how it can manifest? Like it can manifest as depression or headaches or maybe crying or anger or loss of sleep. So many things which I am talking now, you may be experiencing already. So then you have to assess yourself, and then you have to see in which category you fall, because some amount of stress is there for everybody. You have to learn how to deal with it. You cannot be stress free. Only one place is stress free. That is after life. There can be psychological changes, and then there can be behavioral changes, like somebody may go into addiction, or somebody may have some violent episodes, and somebody can have a physiological problem, like their blood pressure may start rising, they may start getting health problems. Here, I'll show you a short video. I don't know how many of you will agree with this.
I'll go now, Papa.
Do what you want anyway.
Hey, what's the matter?
Nothing.
Why are you looking so upset?
You tell me.
Did I do something wrong?
Matlab you don't even know. Great. I'm fine. I told you I'm fine. I'm fine. Thing is so slow.
Yeah, but you can cancel automatic activation.
I know. Just go away from me.
ऐसा होता है क्या आप लोग के साथ?
Listen. Turn off your what?
I'm in the loo, yaar.
Tell you, please. Off fire अच्छा नहीं है.
Off-white अच्छा.
thing we talk about is sleep. Sleep is very important because if we don't sleep, then a lot of changes occur in the body and risk of getting heart disease also increases. So at least 7 to 8 hours of night sleep is very essential. So I emphasize that night sleep is different. It's not like if you sleep at 1 o'clock in the night and wake at 10 o'clock, that is not a night sleep. So night sleep means night sleep. Before daybreak, you have to complete your 7 to 8 hours. And if you don't sleep, not only your cardiovascular system gets affected, even your skin, your look, your brain, your judgment, your memory, your response to any stimulus, everything gets impaired. So all this stress and all these things that we have talked, suppose we don't take care of all these things, what will happen is that there can be either a stroke because of the blockage of the artery supplying the brain, or a heart attack because of the blockage of artery supplying the heart. So how do we deal with it? So one thing I want everybody to know is that heart attack is an emergency and blockage can be diagnosed by coronary angiography. Most important thing is that symptoms may be different. So sometimes people think that it is a gas problem and they delay it and they take antacids and crucial time is lost. So in a heart attack, the muscle is dying. So every minute delay, it reduces your life by almost 10 days. So first hour is very important, which is known as the golden hour. So if you don't open up the artery within the first hour, then the chances are that some of the muscle will die. And most of the deaths after a heart attack, they occur during this period only. And sometimes, if you don't react immediately, your heart muscle may be permanently damaged, leading to heart failure or even death. So I don't want to scare you, but the thing is that in Western countries and in good cities, and when people are aware, like you call up the ambulance and your treatment starts from your home. So before 1 hour, we have to open up the artery. This is known as the door to balloon time. Like door is your own doorstep and balloon is the balloon that we insert into the artery and inflate the artery so that the blockage is opened up. So this is known as door to balloon time. In good places it is less than 1 hour and sometimes it should be even less than half an hour. But if you are staying in a place which is more than 1 hour away from a cardiac center where this can be done, then what do? Then we should thrombolize the person. There are some drugs which will dissolve the blood, so we inject those. That will give us additional time to stabilize the patient and send the patient. So one big mistake which most of the people do is that they, without thrombolizing, they refer the person. I get patients from Himachal and Punjab far off, and some patients they don't even reach, they die on the way. So they could have been saved if they had been thrombolized. So if you can reach within half an hour, 1 hour, then go straight away to the cardiac center. Some people they waste time, they go to a chemist, they go to some local practitioner who is not able to diagnose. Because in females, the diagnosis is very difficult. Even a very well-versed and very knowledgeable person can miss the diagnosis. What is the treatment? Treatment when to open up the artery, if it is suitable for stenting, it can be stented. If it is suitable for bypass, it can be bypassed. And what is the difference? Most of the people they ask me, what is the difference between bypass and stenting? Which is better? People think that stenting is better. So how many of you think that stenting is better? Raise your hands. Those who think that bypass is better. Stenting is easier. It's easier for the hospital and it's even better because with the same cost you can discharge the patient next day. But for bypass you have to have a big team and then you have to take post-operative care. But the outcome is much better. It is more safe and the long-term results are much better. American Heart Association says that bypass is the only procedure which improves the life. It gives us survival advantage. In emergency, like in when you have a heart attack, that time stenting can be better because if only one artery is blocked and immediately if you open up the artery, then the damage is controlled. But if multiple arteries are blocked, then you go for a bypass. So to explain in a simple way, like you have a traffic jam. So what is the best thing is that you widen the road and you make the traffic go in a line, so you can diffuse the traffic jam. But for a long term benefit, you construct a flyover. So the flyover helps in a long term benefit. So the best advantage is that the traffic can go on the flyover also and it can go on the normal road also. So similarly, after a bypass, in bypass we construct a flyover, we put a graft which makes another passage for the blood to go. So blood can go from the normal passage also and the other passage. So if one of them gets blocked, there will be no heart attack. But if a stent gets blocked, there will be a massive heart attack. So chances of having some event in the next 5 years or 10 years are more after stenting and less after bypass. So in the end, I would like to conclude that you should be your own hero and you should decide how to take control of your life. And you should, once diagnosed, you should not feel disheartened, because many times nowadays in their late 20s, in their 30s, women are getting diagnosed of having some high blood pressure, diabetes or even heart disease. So there's no need to get disheartened. If you take care and if you get regular checkups and take proper advice, then you can have a normal life. And also, a few recommendations I would like to make is that first of all, stay informed. So I hope all of you now will disagree that men are more affected by heart disease. Anybody who still wants to have the same opinion, please raise your hands. So most important is stay informed that what is the reality. And then stop smoking, then take a healthy diet, do some physical activity, maintain your body weight and waist circumference, exercise regularly, and also you should take your, if you want to take alcohol, please take in moderation, drink wisely. So if you do all this and take control of your stress also, then I'm sure you can protect your heart and be healthy. So some recommendations which are not medical, but still I would like to make. You should have fun without alcohol. You should talk without cell phones. So this is difficult, but I think this is very important. And then you should dream without taking drugs. So if you can dream normally without taking drugs, it is very good. And you should smile without selfies. So nowadays most of the people, they smile only when they take a selfie. Rest of the time they have straight face. And then another most important thing is that you should love without conditions. So if you do all this, I'm sure you will be able to take care of your heart. And finally, before I go, how many of you think that beauty is skin deep? I think beauty can be attained by getting some cosmetic procedures done, or so actually your beauty is determined by the condition of your cardiovascular system. If your heart is pumping well and if your arteries, they are not rigid, then your skin will glow. You will remain young. So nowadays we don't consider the chronological age. Chronological age is the number of years from your birth. So date of birth does not determine your age. Your age is determined by the condition of your cardiovascular system and your health. So somebody who is 20 may be actually 60, and somebody who is 60 may be actually 20, depending on what is the status of your cardiovascular system. So that is why we Indians, we have a shorter lifespan. We live average 65 years, and Japanese, they live 90 years. So even at 90, you can see a Japanese walking on the road. So, anybody been to Japan? I've been 4 times to Japan, and I was surprised that most of the people, they go walking to their workplace, or if they take a local train, then they go walking. Like there are train stations. Rest of the distance they cover walking. Even in Tokyo. So in India, even if we have to buy bread, we go by car. So that is the difference. So today, let us pledge that we will take care of our health and fitness. So what is health and fitness? Health is not just physical appearance. It is your physical, mental and social wellness. So some people, they don't socialize. So that is an additional risk factor for heart disease. Those people who don't get well with their colleagues, with their family, with their kids, with their friends, they are more likely to get heart attacks and they live lesser. So it is very important to be social also. So any questions?
Thank you very much for an enlightening, very conclusive causes, especially in women, when you can get a sudden, an artery spasm, or it could be, a plaque gets dislodged and gets into the bloodstream, and that can cause sudden cardiac this. So can something be done in that respect to avoid?
And definitely that can be prevented. But as I told you before, that prevention has to start from the early age. It's not that when you get the thing and then you go for prevention. So you have to start even when you are absolutely normal. At that time you should start taking care. First of all, you should get your risk factors assessment, that what risk factors you carry. Then we can tell you how to take care of them. So if we take care of all the risk factors, then we can not only prevent heart disease, we can remain healthier and fitter for longer time. So in health there are two things. One is the lifespan, one is the health span. So Indians, they have a very short lifespan. They have a short lifespan, but their health span is even shorter. So suppose a person gets high blood pressure, sugar and so many other problems at the age of 30. So your health span has been shortened. So if a person doesn't have any health problem, even at the age of 80, then your health span is, suppose you get a heart attack at 50 and you keep on taking medicine, you get another stenting done, you get bypass done. So all these years, you are still a patient. You don't have a good health span. So we have to remain healthy for longer time. Then only you can enjoy your life.
And what about the impact of decreased estrogen at menopause? You mentioned that it drastically increases your risk for heart attacks.
Actually, the decrease of estrogen, it accelerates the progression of atherosclerosis. For that, you have to control that progression by taking care of your lifestyle. Like if you remain physically active, if you control your weight, if you control your waist circumference, if you don't take stress, and if you don't fall into any addiction, then you can control it, slow it down. But if you don't take care of all these things, because it is not only because of estrogen, it is because of other things that occur at the same time. So all these risk factors you have to take control of. And some people who have a early menopause or a premature menopause, we then give supplements. We give the hormonal treatment for maybe till they attain the age of 45 or 50. That will help in slowing down the progression. So those who get early menopause and premature menopause, their risk of getting heart attacks, it increases by almost 40%.
Thank you very much.
Any other questions? Yes.
Regarding the underdiagnosis of cardiovascular problems in women, I understand.
Very important 3 questions. I'll hurriedly go through the answers. First of all, like you said that why they are underdiagnosed. The reason for being underdiagnosed is that their symptoms, they are different. So most of the times they are not able to understand that they have a heart problem. Plus many patients, they don't get any symptom and they get a heart attack and they may suddenly die. So this is more common. In 64% of the women who die, there are no symptoms. And the physiological cause is, the second part of the question is that the females, they have smaller arteries. The chances of blockage at the microvascular level are more in females. And also women, they have more chances of having obesity, more chances of having diabetes. And if the woman has diabetes or obesity, then the risk of heart diseases and heart attacks is much more compared to men. So it is a different physiology in women. So that is why it happens. And the third question, COVID. It is very important that why in COVID we get heart problems. So everybody knows that those patients who have underlying cardiac disease or diabetes, they have more complications, and the chances of landing up in the ICU and dying also more in COVID. That is because COVID not only attacks the lungs, it attacks the heart also. So the direct infection into the heart can also cause the damage, plus the inflammatory response that occurs after the second week or third week. So that impacts the heart. The chances of person going into heart failure are more, chances of getting arrhythmias are more. And arrhythmia, I think you understand, जब फड़क जाता है heart, तो suddenly collapse हो सकता है. Plus the chances of getting thromboembolic complication are more. So clot formation increases. So it can cause a sudden heart attack. So plus, because of the deteriorating lung condition, the oxygenation is less. So the heart will get less oxygen. So its pumping will suffer. Similarly, it will not be able to pump to the other organs. So the other organs can also get damaged. So it is a complicated cycle. Any more questions?
I was just wondering that you said hormones, right? So if somebody has a thyroid syndrome, can be hyper or hypo. So then is it in any way related to an cardiac arrest, or is there any chances?
The chances of arrhythmias, they are more if the person has like hypothyroidism. The person is on medication, like if you are taking thyroxine medication and if you are taking an overdose, then the chances of getting arrhythmias are more. And if somebody has thyrotoxicosis, that is the thyroid level in your blood, they are extremely high, then also the chances of arrhythmia are high. So if somebody is on thyroid medication, you should regularly check your thyroid profile and you should consult your endocrinologist so that your dose remains physiological, like it doesn't exceed the dose that you require. And whenever you start taking, you should not take like suddenly you should not take a high dose. So gradually they prescribe you a lower dose, and then after 1 week or so they step up the dose. So that is to prevent all these arrhythmias in patients.
Thank you so much, sir.